Cool. So a few people dropping in now. So welcome to the Ordinary Review podcast with host me, Gaz from JDC Fitness. You can find out about me at find.jdcfitness.co.uk and Hunter from Average Fitness. And today we've got a special guest. Very happy to have Ross on the show. Ross Gladwin of Ross Gladwin Sports Medicine. Ross, do you want to give a quick lowdown about you, who you are, what you do?
Hi, thanks very much for having me on the show as well. I hope I can give you some an insight into what I do and answer some questions regarding sports medicine, regarding rehab, anything that people kind of find interesting in performance. I've always been interested in the human body. When I was at school, probably the only two subjects that I really took notice of were biology, with human biology, and PE. After leaving school, I went into personal training. I kickboxed throughout my... kickboxing's a massive passion of mine. I've kickboxed since I was 4 years old. And as my career progressed, I just felt like the fitness industry for me, I felt like I was missing something in my passion, and injuries were my passion, and human performance was my passion. So I studied an undergraduate degree. After studying my undergraduate degree, I opened my own private clinic, and then decided that I wanted to go down more the medical route. I wanted to give my patients just that little bit more than what they were getting from the NHS, or just that little bit more than they were getting from their average private sector. And then I had a real kind of fortunate turn in my career where a professional cycling team who compete in the Tour de France, Groupama Francis Leger, they asked me to go and work on their physio team. And it kind of opened my eyes to the sports medicine world. And not only how it's done in the elite level, but also the crossovers that we can take what elite level athletes are doing, and how we can benefit from a much better diagnosis in clinic with our practitioner, so we know exactly what we're working with, but also into the blood analysis stuff, which is something that I'm trying to kind of delve my clinic into now, to not only look at performance, but also look at the other biomarkers in your blood to make sure that your health is as optimized as it possibly can be. And in the future, I just want my clinic to grow and grow and grow. I want to continue to offer a premium service at a very, very manageable rate. I don't want to become one of these London-based clinics where it's absolutely ridiculous. I want to offer this elite level service to the people around me and keep it as ethically standard as possible price-wise.
Yeah, I think that's if I can just jump in, I think that's a really interesting concept in terms of most things, especially in the sports world, will come from the top down. You know, you see the elite level athletes will have this process, that process, and then over time, as that becomes more normal, it kind of filters down to a diluted version to the likes of, you know, us lot, who you might not get that same level of service, you might not have that same level of insight into exactly what's going on, but the kind of residual, you know, drip down effect becomes normal in the normal gym world. I had a quick question based on something you said. Actually, you kind of alluded to a point which I've forgotten now, which was you said misdiagnosis or a better diagnosis. Sorry, is that something that you see quite a lot, where someone is being told, not necessarily by like a doctor, but even if it's just off their pal, oh yeah, I injured my leg in the same way, this is what you do to treat it, but that's actually only 75% right, and that's causing them more problems, like in the short or the long term, like a slight misdiagnosis.
Absolutely. I think the health industry and the fitness industry are kind of aligned in that people don't have the guts and ethically we don't have the ability to say, do you know what, I don't know what this is.
We've discussed that, like, people too scared to say they don't know.
Too scared to say, I don't understand what this injury is. I don't understand why your testosterone levels are so low. I don't understand why your thyroid isn't producing the right amount of this, where your hormones are completely imbalanced. It's absolutely fine to ask for help and use this hierarchy of people that we have and hierarchy of knowledge that we have. We live in a great world where we have access to so much good information, but as a caveat to that, we have access to absolutely terrible information as well.
Yeah.
And three that really annoy me in the musculoskeletal world, three terms which I'll try and kind of grow these terms if you don't understand these terms. The first one being sciatica. Sciatica is a term for a type of pain. That is not an injury. There are so many different things that can cause sciatic pain. And so many practitioners will say, you've got sciatica, but what type of sciatica do I have? Do I have a bulging disc? Do I have a collapsed disc? Do I have a herniated disc? Do I have muscular tension, which is causing a compression onto the nerve? Are my hamstrings too tight, which is, again, causing this impingement? We're just going to umbrella this as sciatica because I don't really know what's wrong. And it's fine to say you don't know what's wrong and ask for other help. Radiculopathy, which is the same type of issue higher up in the spine, again, a compression of the nerve, but is it a severe compression of the nerve, or is it just some muscular tension, the fact that you're sat at your computer for 8-10 hours of the day because we're stuck in a lockdown? Tell me that you don't understand. And the one that really, real bugbear for me is rotator cuff issues. There's 4. There's 4 rotator cuffs. They do 4 completely different things. Don't come from me, I've got rotator cuff issue. Well, which one?
Yeah.
That's almost like saying, I've got a hamstring problem. In which leg? I don't know.
Well, this
the 2 legs.
with me though, wasn't it?
That's cool.
Before I came to you with my knee, I had so many diagnostics. I had a torn quad. I had that.
Which there are 4 of.
Yeah, and it was like, as soon as you tested, you were like, no, the quad's fine. I'm trying to think what else this had said. The first doctor, the GP, turned around and said that I'd swollen my calf, and I was like, it's not, because I've got big calves, man. There was a couple of other things, and then straight away you were like, no, ACL and your meniscus, and there you go, straight away. There was a diagnosis from the first outset. I had been with the NHS in and out of what's it called? Physiotherapy, not very well thing, in and out of physiotherapy and raining all over the shop. And I lost you.
No, still there.
No, it's still here.
I've been in and out of the physiotherapy and just got nowhere. And then within when I started rehab with you and the treatment with you on my knee, probably 6 months to a year, I wasn't just back walking what they were aiming for. I was back competing. I was at the level to compete in kickboxing, which I didn't think I would get back to.
Yeah. I think something I really want to push for people if they are watching this or they watch this in the future is, in my personal experience, it's just my opinion. There is a lot of doctor bashing at the moment. I went to see my GP and I didn't get the right treatment. Yeah. Musculoskeletal therapy and what a GP does are 2 completely polar opposite things. I have a lot of friends who are doctors and I work with quite a bit. I work on a training course platform with some graduate doctors. Doctors treat ill people. I treat injured people. There is a big difference. If you have a musculoskeletal problem, such as a hamstring strain, invest a little bit in yourself and go and ask somebody who is a specialist in that area. Yeah. If you have a gastric problem and you're going to the toilet 5 times a day when you shouldn't be, go and see a GP.
Yeah, that makes sense.
For the right advice from the right area. And
it sounds so simple, doesn't it? Like it's such a simple idea, but it's like, well, yeah, like, you know, but like you say, most people probably just
is dying out. I think that generation is dying out. Like my mum's mum, my nana, she almost had her GP on speed dial. Everything, literally everything. She thought the doctor was the be all and end all. And doctors are absolutely phenomenal at treating sick people.
At what they do, yeah.
But don't ask a doctor in an area which they don't have, they're not a specialist in that area. Don't come and see me if you have a rash on your skin, because I wouldn't have a clue. We need to go to the right people. And
referrals, like, not trying to bash a doctor, but like a doctor will say, like, go home and rest it and take paracetamols. Like, no, tell us to go somewhere else. Tell us, that's the referral thing again. Someone who reached out to you last week, I think he did, one of my online clients, he says, I got told last night I've got sciatica at A&E, but they didn't mention which kind. That's exactly what you just said.
So sciatica is an interesting one. So to break sciatica down into 2 really easy forms, we have axial sciatica and appendicular sciatica. So axial sciatica, if you imagine the axis of your body is your spine. if you are suffering from axial sciatica, something is wrong in your vertebrae. And our vertebrae is split into 3 different segments: the lumbar vertebrae, the thoracic, and the cervical at the top. And generally, sciatic pain comes around the lumbar vertebrae, in particular, 80% of the time in lumbar 4 and 5, the 2 bottom discs. If it's axial, you're probably going to need further investigation than what even I can do with diagnostic ultrasound. You're probably going to need an MRI and some sort of really in-depth imaging done on that area. However, appendicular sciatica is off that spine. So something, your glutes are too tight, your piriformis is too tight, your obturatus is too tight, your hamstrings are, and don't use the term short, because that is one of the stupidest terms in the musculoskeletal world, short hamstrings. They'll never change in length. They attach at the top of your leg in an area, and they attach close to your knee in a certain area. They'll never change in length. They just change in elasticity. They don't get shorter and longer. If they get shorter, you really need to go and see a doctor. Or join the circus.
Muscles for the thigh gap.
Yeah.
I think he is booked in to see you anyway, so that he should get that sorted.
Perfect.
One of the things that we're looking at the general world of training for people, like you've got a great post for the guys squatting. I see it on your page, and it's like injuries are going to happen. Like,
of course,
stop blaming form, stop blaming weight, stop blaming. It's just shit's going to happen. Like,
yeah.
What's your thing? What would you say for injury prevention?
Injury prevention, my biggest thing, so, and this is very generic, just purely off my clinic, the biggest way to prevent injuries, 2 things. A, don't do the same thing over and over again. And B, mobility and flexibility. The 3 areas of sport that I see the least of in my clinic are dancers, gymnasts, and martial artists.
Because they spend 80% of their time warming up before the start.
Warming up, being mobile.
Yeah.
They have more movement at their joints. And the sports that I see the most of are the most repetitive of sports. Runners, footballers, the same motion over and over and over again. Directional change isn't as big, and therefore repetitive strain starts to build up.
So is that I don't know whether I'm oversimplifying it. Is that because you're as a sprinter, for example, or whatever, like you say, the sports that you see more often of, is that because you don't tend to work the supporting muscles as much as you do the main muscles that you use, whereas in something like martial arts or dancing, you kind of all those supporting and kind of smaller muscles are kind of working together. Yeah.
The directional change. So with more directional change comes more recruitment of more muscle groups.
Recruitment was the word I was looking for. Yeah, that's right. Yeah.
And with more recruitment of more muscle groups, more activation happens. And muscles can do 3 things. They can shorten, they can lengthen, and they can stick solid. So concentrically contract, eccentrically contract, and isometrically contract. But if those movements, if you have multiple muscle groups moving all of the time, the elasticity, the recruitment, the strength, the ability for those muscles to not be affected by overuse is so much better. However, it's just the same motion constantly over and over and over and over again, in particular running, inflammation builds up, stress builds up in the area. Sometimes nutrition's not great, sometimes sleep's not great, sometimes workout cycles aren't great because of everyday work and life. So people will run Monday, Tuesday, Wednesday. They shouldn't do that. Their body doesn't have the ability to do that. And that's where injuries come from. The best saying you can think with that, if you're repeatedly injuring yourself the same way, just remember this saying: if you always do what you always did, you'll always get what you always got.
Yeah.
Don't keep repeating things. If you're constantly injuring yourself the same way, you need to change something, mix something up. And I think the outside world would be incredibly shocked if they saw an Olympic athlete's training program.
Because it's so varied.
So varied and not as much as you think.
Yeah. I think that's a really interesting point, actually. Not as much as you think is a really important point. Like we talked about it, I can't remember whether it was last week or before, about not necessarily overtraining, but that kind of desire to train more to get more results. It's like, that's not necessarily how it always works, you know. You might want to train more because you love it, that's fine, and obviously you can kind of wing it a little bit in that regard. But if you're doing it for the results, that's not necessarily a smart decision to make.
It goes into the thing, doesn't it, about like, don't go too fast, like with anything. Your diet, if you go too extreme on your diet,
yeah,
you're going to stall, you're going to fall off your diet. You go too hard in the gym, you're going to get injured, you're going to burn out. Everything's got to have moderation. And that's what you said, like an Olympic athlete, like they might be like a sprinter, but they're not going to sprint every day, and they're not going to be running every day because their performance is just going to drop. And like that's it. So the couple of questions that came in, and you literally said nutrition as this question came in. Marcel asks, do you know if there's any relation between injury prevention and nutrition?
So there is absolutely a correlation between bad nutrition. I'm not a nutritionist. I will never ever claim to be a nutritionist. However, you need to feed muscles, and if we don't feed them correctly, they're not going to be able to rebuild, recover, restore as well as they should be.
Yeah.
And I think that's one of the things we should take from elite sport. Look at nutrition in elite sport and how much that's transcended in the last 20 years. How athletes were eating 20 years ago to how athletes are eating now. And something really interesting with that, I read Clive Woodward's book. Sorry, I didn't read Clive Woodward's book. I read one of the England rugby players' books a few years ago. And he said that obviously rugby in the past has been the fry up for breakfast, go out for a drink after the game, and just a load of lads like smashing into each other. And obviously it only turned professional a number of years ago. And when Clive Woodward took over England, that's how it was. They would go and there would be a buffet of breakfast, and they'd eat what they wanted at lunchtime, and everyone was happy. Clive Woodward took over England, and all of the players had their body fats taken, their metabolisms read, their blood analysis blood work done almost on a daily basis. And the day after they turned up for training, each player's name was marked out with a protein shake or a carbohydrate shake, and it was set to what each player needed. Tailored specifically to their needs. And we need to take that. Yes, nutrition is a huge correlation.
Another one came in. I think I've got a strain in my lower lat, if that's a thing. Feeling slight improvement a week on. Can I train, or are you meant to recover fully?
Right, so that's an interesting one. So strains, all kind of soft tissue damage. Well, not all soft tissue damage. The majority of soft tissue damage follows three processes. And there's the rule of three for how badly injured it is, and also the rule of three for how it recovers itself. So let's go with how badly injured it is initially. So to make a correct diagnosis, yes, we would need to use some sort of imaging, and that's why professional football teams such as Manchester United have MRIs on site. Now, we can injure a muscle, either a grade 1, a grade 2, or a grade 3 strain, sprain, tear, whatever we want to call them. A grade 1 is up to 20% of the fibers in that muscle have been affected by that injury. Up to 20%. What you're going to find with that is a little bit of soreness on the point of the area. However, movement's not going to be impinged that much. Grade 2, we're looking at up to 60% of those fibers are going to be affected, and the movement is then going to start to be impinged. Grade 3, the worst and the easiest to read, is a complete rupture of that tissue. You're going to see a blackening around the skin, a blue kind of bruised hematoma around the skin, and there's going to be complete lack of movement in the area. All three of those, obviously, depending on the scale level, will take a longer period of time to recover. But interestingly, the guy said, a week ago that he felt like he'd strained his lat?
It's a lass, it's Jill. It's one of mine. It's one of my clients. I think it was 2 weeks ago that she pulled it. And it's a week on. She started feeling better a week on.
Right. Okay. So what we need to understand about recovery processes is how tissue repairs itself. So we have three phases to that as well. So 3 phases of repair: acute, subacute, and chronic. So in the acute phase, as soon as you injure yourself, your body will inflame the tissue. I don't want to go too sciencey and too kind of molecular here, but your body will inflame the tissue to protect it and to get it ready to repair it. So it will inflame the area, fluid will be put into the area, and you get swelling. At that point, that can last up to 72 hours. So that's going to last 3 days in that period of time, depending on nutrition, which was the previous question, sleep, and also your access to a musculoskeletal therapist, to a physio, to an osteopath, to a sports rehabilitator, whoever it is. We can get people out of that phase fast. The next stage, with the subacute stage, is anywhere from 72 hours up to 10 days. And that's when your body's going to start to put the healing properties in. So essentially like building a house, that's when the cement's going to go in. But that cement hasn't set, and its majority of it is collagen in the human body and how the human body repairs. During that phase, that is the most risky phase for re-injury, because you're starting to feel better because the swelling's come down. So your movement's improved again. However, the tissue has not repaired properly. It's still soft. And use that cement example. We then move into the chronic phase, which is kind of 10 days plus, and that can go up to 2-3 years, depending on how bad that tissue damage was and what the severity of the scar tissue is. And that's when our body's trying to kind of regain molecular structure and align those fibers again. So 2 weeks ago, we're probably looking at chronic phase. So the wound or the strain, the sprain, whatever we want to call it, that should be in the chronic phase now. So movement is key for that person. The more they move that area, the more fresh oxygenated blood they get to the area, the more their body has the ability to regain that molecular structure and regain normal function of the lat. It just depends on the severity of where it was 2 weeks ago.
So at that point, would you
stop being a soft shite and go do deadlift?
So at that point, if I'm understanding it right, would you say that in that third phase, in the chronic phase, it's a case of exercise, as in, moving the injured part a lot, but at a lightweight or no weight, more of a physio type approach rather than a how heavy can
absolutely
I lift?
Yeah. So I base all of my rehab on the 7 primal patterns of the human being. We all, since Paleolithic times, we move in a certain way. So let's use the quad as an example. So many physios, the NHS, so many other musculoskeletal therapists are still giving out these ridiculous movements which aren't going to elicit enough of a response, and also aren't anything like what this patient is doing on a day-to-day basis. Your main rehab, if you've pulled your quad, should be the squat, because you're going to have to sit and stand up out of your chair every single day. And if you can't do that, you're not going to have much function in your life. And not only that, with a squat, you're going to recruit so many more other muscle groups, which are going to assist in the movement and the building of that movement, again, in the injured tissue.
It's kind of like getting the balance between too much rest and not a lot, isn't it? Like, I remember the story you told us about the hamstring tears in the NFL. Like, 10 years ago, it would be rest until it's gone. But nowadays, it's like work through them. Like, they've got them working it straight away to get the blood back in there.
So that's a massive thing. I use the cyclist as an example here. So if a cyclist injures themselves, the first thing they do is train again.
Yeah.
Because through movement, we have the production of oxygenated blood, which is fresh blood, and also the production of lymphatic fluid. And we're removing the toxins. And we talked about that acute phase, that inflammation stage. If I can get my patient out of that stage faster, I can get them through the subacute stage faster, and then I can get them back onto the pitch or back into the ring, back onto the bike, whatever it is they do, back just to work.
So it has a compounding effect, getting that first stage done quicker than
done as quickly as we possibly can. Yeah. Okay. A great example of that is Aaron Ramsey, who plays for Juventus, Wales footballer, broke his tibia. He had a spiral fracture in his tibia about 4 years ago, and he played 10 days later. If you spirally fractured your tibia at night, you'd be in a cast for 6 weeks. And that is a kind of the amount of kind of exposure he has to really, really good therapists. Yeah. Nutrition perfect, sleep perfect, everything is correct. So he gets him, the team have got him out, the multidisciplinary team that will be at any football club, at any professional sports team or any professional club, get him out of the acute phase as fast as possible, out of the subacute stage as fast as possible, into the chronic phase, and return to sport as quickly as we possibly can. And not limit motion, because if we limit motion, then we're going to get atrophy, which is muscle wastage. Yeah. That's why we see so many athletes now using Compex to try and stimulate muscles whilst they are injured, so that they can regain this. Oh, sorry, they can. What's the word I'm looking for? They can maintain. Sorry, the amount of strength that they have in certain tissue.
Disclaimer: I will say though, if you do injure yourself, it's retraining but under guidance.
Oh
So,
yeah, absolutely. Don't go for a run if it's not.
I've just hurt me back doing deadlifts, so them guys on their side, I'd have to go do deadlifts tomorrow to get it back.
Absolutely, yeah.
Just a disclaimer to cover myself before someone comes back.
Yeah, it's interesting. I was thinking that about 10 minutes ago when you first mentioned, that inflammation stage, the very first stage, and then once that starts to recede, that's when you're most vulnerable to getting re-injured, and it's because you feel like you're getting better, because it's less painful. And I suppose it's finding the balance in it between moving more to rehabilitate the muscle, but not thinking that you're fine. Do you know what I mean?
Yeah.
That's the trick in it. And for the people who are, let's face it, for our viewers, the people who aren't elite athletes, that's going to be the trick every time, is when do you know I can push it? And when do you say, no, I need to rest, without necessarily
re-injuring himself,
without seeking advice from someone like yourself? Like, is there a way to kind of, eyeball it a little bit, or is that just not something that is possible?
No, I completely think that a lot of injuries can be managed purely by using yourself as your own doctor. So just using simple things such as pain scales on a pain scale of 1 to 10, and how rapidly your pain scale is reducing with certain movements. And then you alluded to this before, it's got to be a scaled rehab. It can't be my back's gone doing deadlifts on Tuesday the 1st of the month, and on Tuesday the 8th, a week later, it feels all right, so I'm going straight back to 200 kilos. Use that movement. The movement's beneficial, but just take your volume up for a little bit. Do some back off sets. Do a heavy set followed by a slightly lighter set, and reintroduce things gradually. It may be your body telling you initially. So when you injured yourself on Tuesday the 1st, it may be your body to actually telling you you're not ready to be doing this type of training.
Too heavy,
like a water shot.
Or the straw that brought the camel's back. You shouldn't be trying this. We aren't in a position to be able to justify this.
And that's an ego thing, isn't it? I think once people get to, especially people who are really into it. Yeah, I mean, everyone does it. Everybody who's really into lifting weights, there's nothing worse than regressing to a lower weight for whatever reason. It's a real gut punch when it happens.
Even at the level when you know that it's the right thing to do.
Yeah, 100%.
I don't want to do it. I don't want to go back weights. I don't want to do lighter weights for more reps. I want to do the same amount of reps at heavier weight.
Nobody wants more reps. No.
Yeah. And it seems to be that when you do get your kind of personal best or your personal record, or you go out for a run and that you run your kind of sub 20-minute 5K, whatever it is, no one ever sees that. However, when you're going through your rehab and you're lifting 2-kilogram dumbbells, you seem to see 20 people that day.
Yeah.
And the ego takes a massive hit.
Walks in when you kind of call a 2-kilo dumbbell.
Yeah.
But
it's interesting.
The chronic thing, it's exactly on a very lower scale. It's the same as DOMs. Like, if you've got DOMs and you sit around all day, like if your legs are knackered from leg day, you're going to be in pain for like 2 days. If you get up, go on a walk, even a jog, you're going to get through it a lot easier. Like, I tell all my clients, especially new ones, you're going to be sore tomorrow. Move more.
Get up and go for a walk.
That's the best thing. So just get through the pain.
Yeah, that makes sense.
Managing DOMs is one of the massive ways you'll prevent an injury as well.
Yeah. So
be mindful of, again, your kind of structure of your training. And I don't know, I'll use mine as an example at the moment. So I currently run on a Monday. I currently do deadlifts and squats on a Tuesday, and I rest Wednesday. And on Thursday, I do upper body. So I know that I've had 2 hard leg days, and I'm going to give myself enough recovery. And by the time I train on a Friday, I've had a 72-hour period where my legs haven't had to do anything hard. Not run Monday, deadlift Tuesday, squats Thursday, and I'm going to try and do some hill sprints on Thursday. You're not, because your legs will be buckled.
People often think, right, I've done the gym on like Tuesday and a Thursday, which is fine. but instead of having rest, they think they need to push, and they do like cardio and hit, and they think that it's a rest, but it's not.
Yeah.
A really good analogy for that is like, I'm a massive documentary fan, and I would advise everyone to go and watch these two documentaries. The first one being Dawn Wall, about Tommy Caldwell, one of the best climbers in the world, who's one of the first people to free climb El Capitan in Yosemite National Park. And then Free Solo, which I think is Alex Honland. And Alex Honland actually free soloed El Capitan as well. But they use an analogy in that if you were to climb, obviously the skin on your hands takes a massive battering off the kind of granite rock on the Yosemite National Park. So what they have to do is they sandpaper their hands, and then they'll leave it for a couple of days, and it starts to calcify. And when it starts to calcify again, they sandpaper their hands. And this process will take weeks, if not months, for them to really kind of solidify the skin on their hands to get them prepared to be able to do a climb like that. If they were to rub their hands with sandpaper every single day, what would happen? It would bleed.
Yeah, it would never heal.
That's the same as a muscle.
Yeah.
If you
I've heard that analogy
every
before, I just never knew where it was from.
If you push it every single day, it's not going to get better. It's not.
100%.
And we've all followed this German volume training thing, which was Rolf Fesser in 1976, which is 10 sets of 10 squats for 10 days. DOM's absolutely destroying you by the third day, and you just work your way through it, and everyone's injured by the end of it. They were smashing performance enhancing drugs as well. That's why there was no DOMs.
Their bodies were covering within minutes.
Yeah. Exactly.
I think that's
stop following like people's thing. Rock's training plan. Eat the Rock ate for a day and training like the Rock. Like, no, you just.
I think that's probably a misconception when it comes to performance enhancing drugs, which I'm sure we could talk about for weeks. Is people think you take steroids when you lift things, your muscles grow quicker. It's like no, your muscles recover quicker, so you can train more. That's
absolutely
kind of how they work. So
absolutely,
it's not a case. It's not a magic fix. It's a
even down to
how can I double my training load? You know,
such as EPO in cycling. EPO doesn't make you have a better cardiovascular system. It gives your body the ability to produce more red blood cells. Yeah. So if you push hard enough, your body will recruit more red blood cells. So there's more oxygen uptake, so you can perform better. If I took EPO today, I wouldn't be riding in Paris-Nice at the weekend. Mm-hmm. I'd still be an overweight cyclist.
I think the stigma on like performance enhancing drugs and steroids, to blanket it all, is people think massive. They don't think that everybody is all these top level athletes, and where there's money, there's drugs. Like, all sports are using it. However, the only person who hasn't been done for what's that meme? It's like the only person who hasn't been done for doping and running's Usain Bolt. Like, he's the only one who hasn't been done for doping. But people think big drugs. So like, I'm lost my train of thought again.
Steroids getting massive.
Yeah, and they don't realize that like all these other people are still using them, so they think like, oh well, I can train at that level and stuff, and they just can't.
Yeah.
Well, I think a really good example of that is snooker and darts. So they banned the use of alcohol. Alcohol is an antidepressant. And you know what it's like, even if you're just playing pool or darts with your mate. When you get to that vital shot, your nerves go, don't they? And you start. Say I was playing you guys and we said, right, this is for a tenner, and I get onto the black ball, your nerves start going. So alcohol was used to try and calm nerves, as were beta blockers, which they're not performance enhancing drugs along the same lines as EPO that Lance Armstrong was using, or stanozolol, which Ben Johnson was using in the 100 meters. Not the same type of thing. However, they're still performance benefiting. So even alcohol is a benefit to a snooker player because it will have that antidepressive effect, and it will just calm them down a little bit. So on those big shots, they're not going to panic as much. And I think the performance enhancing drug world is a murky subject. to say
it's
the
just,
least.
yeah, we were saying before, it's a slippery slope, isn't it?
Definitely, and we're probably just on the cusp of where it potentially could go as well. In regards to technology and gene doping, and it's probably going to get worse. Well, I'm not going to put myself out on a slate to be shot at, but
definitely getting worse.
yeah. Do you know what I think?
Worse mainstream as well, like easy accessible, like people can get with social media now, people can get info on biohacking very, very easy, and where to find it. And like obviously BP517, which is like the drug for the peptide for healing ligaments and joints and that. People are finding out that they're buying it, they're thinking it's going to be like an injectable, but it's a powder. So they go on YouTube, you can find on YouTube how to recreate it back into what you need, and it's all there for people. And that's the scary part. Like, there's no regulation. The world would be so much better if it was just educating people on performance.
Yeah, I think what's difficult with performance enhancing drugs as well, and I think we spoke this before and live tonight, that our as a generation, our need for continuous improvement. Even if you just look at iPhones, when the new one comes out, you want the newest one.
Logically, you can sit down and say there's not much difference.
There's not much difference. There might be a slight change, but we want it. And we don't want to watch the Olympic. There's no Usain Bolt at the Olympic Games this year. He ran 9.58, like an incredible super athlete. You don't want to watch somebody run 10.5. We want to see the 9-second barrier broke. Yeah. But to do that, things are going to have to be pushed in certain sports. And sport is such a political superpower as well, especially for host nations at big events. Where there's rules, they're going to be broken, aren't they?
Yeah, like we test for drug usage. Yeah, but you tell them when they're going to test, and they've got that many people. They've got these high-level chemists who can tell that your cycle of drugs is going to end May 15th. It'll be out your system by May the 22nd, and you're getting tested on May the 25th. Like,
the people doing the tests aren't the cleverest people in the world. So therefore, there's going to be people who are clever enough to figure out how to break those rules without getting caught.
Is it the ones who called out Sonny Webster, who was 100% legit and swears down and fought it black and blue that he didn't use anything? They found ostarine in his system, and it was from using like glucosamine, because ostarine's got joint repellent properties, and the company had been using small amounts of ostarine to help boost their glucosamine, and he got caught on that, and he had and he was clean. And I think is it WADA? No, it's not. It's the ones the Olympics use who just show up randomly. WADA. Yeah, they just.
So you have what's called Adams system. So the cyclists, for example, they have an Adams system. So if they're not at races, they're kind of continuously tracked to where their whereabouts. They have to input whether they're going on holiday or whether they're going on training camps, so that the World Anti-Doping Association can follow that. And I think some sports, the drug authorities from one sport to another isn't the same.
Yeah,
cycling is very, very good now. So every rider comes over the finish line and goes straight into the doping tent.
Do you think that's from Lance Armstrong? Do you think that's from him getting caught? Do you think that put a lot of eyes?
I don't know, but I do agree with Mark Cavendish, the British sprinter, that if every sport tested as much as cycling, we'd have a completely different view on sport worldwide. Yeah. Cycling is phenomenal now at the way they test.
Because it got a bad rep, obviously, with it being such a high profile case, and then I think the manner in which that all came out in his kind of defense, I haven't looked into it a lot, but from what I took from it, his defense was, I was just doing what I was told everyone else was doing, which may well be the case. Maybe it wasn't, I don't know. But that just goes to show that wasn't an isolated incident. That was a network of this is what we're going to do. This is, to keep up with what everyone else was doing. It wasn't like one dodgy coach saying, "Here, I'll slip you a little something." It was like real top level stuff,
Yeah, I think,
like you say, that's probably going on in most sports.
Yeah, it almost became like a rite of passage, didn't it? The cyclists in that era were doing it, and it was pretty much a given that I would imagine from the research I've done into that area and the books I've read, that there's a couple of really, really good books. George Hinckaby's book, Tyler Hamilton's book, they almost said it was you do it or you find a new job.
Yeah. I think when you're put in that position, it's, you know, people make decisions they wouldn't normally make. And, you know, it's understandable.
Absolutely. And it's very easy for us on the outside to say, well, I wouldn't do that because that's ethically not right. Probably the same as a lot of people when Jimmy Carr got done for tax ethically. I wouldn't do that. But if a chartered accountant told you they could get your tax down to a certain amount, a lot of people would probably do it. And
everybody's taking a cash in hand job at some point. It's exactly the same thing, just not on the same scale, isn't it? You know?
Yeah.
So just kind of coming back to like more injury specific, you know, regarding that, do you think there's a comparison to make between, you know, the guy on the street or the girl in the gym or whatever who isn't necessarily looking to bend the rules in terms of performance enhancing drugs, but from an injury recovery perspective, you know, is there do you see that where people have said, oh, well, you know, I had a bad back, I was diagnosed with sciatica or whatever, and, you know, someone I work with, they used to have a bad back and they've got these really good painkillers. So, you know, is that the thing that you come across at all? Or
every day?
Yeah.
Everybody's grandma's their pharmacist. The amount of people I speak to on a day-to-day basis who come in my clinic and they tell me the pharmaceuticals that they're using, and I say, did the doctor give you that? No.
Well, no.
My auntie Sandra had some from 17 years ago.
Hardly using it.
From 17 years, and then you tell them.
Again. Paul's asked, do you have an opinion on whether some sports wouldn't survive with doping testing, like bodybuilding? I think the sports would adapt. The sports and stuff always adapt, but I think the viewership would change. Like you said, nobody wants to see anybody running 10.5. Like, we want to see better. Nobody wants to go to bodybuilding to see normal people with a little bit of muscle.
No, you want to see a freak.
You want to see this big ass Ronnie Coleman, lightweight baby. I think that's across the board in most sports.
Well, it's interesting you say that. So if you do a bit of research into the Mr. Olympia itself, a few years ago, Mr. Olympia or Wader, who run Mr. Olympia, suggested random drug testing at the Olympia event. And the 5 main sponsors of the event pulled out. Because you've just said it. You don't go to the Mr. If you go to see Mr. Olympia, you want to see a complete genetic freak.
Well, even if you just look at the winners, you know, they're not necessarily like it's a common kind of theme, isn't it, in bodybuilding, of like the golden era, the classic era, when they weren't absolutely enormous, but they were more aesthetic. And it's kind of it's kind of shifted, and nobody,
Frank Zane era,
everybody's kind of talking about, oh, you know, that was better. Nobody's going backwards. There's nobody, you know what I mean? No one's saying, oh, I'm going to be the one to downsize, you know.
And I think Ronnie Coleman kind of changed things because he just went so big, the judges couldn't go against it.
Yeah.
And it was just rather, and I think a lot of I'm not a massive bodybuilding fan, but a lot of bodybuilding purists think it's gone too far that way. And there's huge interest now in classic physique.
Yeah.
In male classic physique.
Getting a lot more following now.
Yeah. Because to see a guy with a 28-inch waist on stage, 27-inch biceps and 40-inch thighs like Big Ramy, it's just unbelievable to think that somebody can be that big. But for the everyday man, probably the classic physique, the likes of Flex Wheeler, Frank Zane back in that day, Ryan Terry, even one of the figure guys, I'd rather look like that. I have to be honest.
Everybody would love to look like the Ryan Terrys. Nobody wants to look like your Rich Pianas and your Big Rammies.
No,
you don't pay to go see Ryan Terry. On stage.
Yeah, that's an interesting way to put it. Yeah,
like he's amazing what he's done and what he looks like. But again, he looks good. But you see King Kong over there, he looks awesome. Like,
that's an interesting way to put it.
He look awesome. I just want to stare at him. Like,
I would rather look. I'd rather look that way, but that's more impressive kind of thing. I think bodybuilding's probably the exception, though, isn't it? Like you say, most sports you wouldn't want to go backwards, but bodybuilding they've kind of approached it and went, well, maybe, I don't know, you know.
Well, well, with bodybuilding, like a good comparison to bodybuilding, it's almost like modern day ethical circus show. So you watch The Greatest Showman.
Greatest Showman, Lady
The Greatest Showman, the tallest person I can get, a really hairy woman. That's what the Mr. Olympia is. You don't want to go, oh yeah, he looks like the guy from the gym. You want someone to walk on stage and go, what the hell is that?
Yeah.
But that's what we want to see at bodybuilding. But we also want to see that at the Olympic Games. I want to see somebody throw a javelin into the crowd.
Yeah.
I want to see someone run and burst into flames like Stop giving that guy more drugs.
There was a theory put forward a while ago, which was like, we should have 2 Olympics, have a clean one, and then you can have whatever is going to make you faster, stronger, etc.
The viewership would be like,
that would be interesting. Yeah, but like you say, it's a slippery slope, and like people would end up getting hurt or worse, and then it would be, oh, why did we ever allow it? And all
why did But then I heard an interesting quote a few months ago about, obviously, WADA are doing their utmost, which they should, because we should play fair, clean sport. They're kind of 2 slogans. But on the outside world, if we take it away from elite sport, access to performance-enhancing drugs is becoming a given for the average person. So we have the ability to now go to any health food shop and buy SARMs, selected androgen receptor modulators, which are banned by WADA. We can buy pro-hormones over the internet, banned by WADA. People are taking Viagra, which is a performance-enhancing drug, really. It makes you perform better. Yeah. And we're almost on the cusp of, if WADA get this right, and that we do play fair and clean sport, when Anthony, let's just say 15, 20 years time, and they have really nailed it, and a big fight coming up, Anthony Joshua against Tyson Fury, they will be the 2 only people in that entire stadium who are clean.
Yeah, that's interesting, isn't it?
Yeah. Everybody else in the stadium will be, because look at America, testosterone replacement treatments for men. Yeah. That's not allowed in sport, but it's allowed if your libido is too low. And you're a 45-year-old office worker.
It's so easy. Like you might be someone who hasn't heard of a drug or a SARM or a thing in your life, and then you see something and say like, Dural got caught with cardarine, and you go, what's cardarine? You put cardarine into Google. The first thing that comes up is either going to be how to use it or what it is, or where to buy from.
And you can buy cardarine at most health food shops now, which is incredibly confusing.
Is it what you're buying, or is it a bump product? Is it something else? Is it a pro-hormone master's cardarine?
Yeah, and that's why I would implore that if you are an elite athlete, have a proper nutritionist who is going to have your supplements checked. Yeah, because 100%. It's, we talked about these umbrella term things. I wish when athletes get caught with drugs, they just say, you know what? Yeah, it definitely was. I've been trying to push it. I wasn't getting the results I wanted, and I've done something I shouldn't have done. I'm really sorry. I will take my ban. But it's not.
For that paycheck, so I'm going to.
But that's not what athletes say. Athletes will turn around and say, "Oh yeah, it was in the beef I ate." No, it wasn't.
It wasn't. That's probably
that's protecting that income.
Where do you buy that beef?
What beef sandwiches are you having that give you that ability?
But it's difficult because an amateur. I don't know, let's use kickboxing, the sport I'm in. So some events you are going to be drug tested, but a young lad who trains by himself or trains with his dad or trains with his friends, he's going to think that something you buy in a health food shop is fine.
Yeah.
Because you can buy it over the counter. You can't buy cocaine over the counter because it's an illegal drug. Yeah. But you can buy SARMs over the counter, and they are illegal drugs in sport. Yeah.
And it says dietary supplement, take one tablet twice a day with food or something. And then it'll have the same disclaimer that is copied and pasted on every nutrition, I think it's even on whey protein. Do not take it to a breastfeed, blah, 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 all the stuff that it's legally got to put. But it doesn't tell you how to come off the product if you need to. It doesn't tell you any what to use with it. There's no regulation, no direction, no education with it. And like you say, some kid who's builds muscle, strips fat, well, that's what I need to do. Starts doing shit and doesn't know
you go on any supplement website, any protein based kind of company that is selling powders and shakes and bars and all that. If you buy something on there that says this will burn fat, you just think, well, it's, that's fine. That's great. That's what I'm looking to do. Why would you think differently if you were going into a health food shop? I don't follow that train of thought that says, well, I better be careful with this. And I think that's where we've talked about it before. A little bit of information is very, very dangerous, because if you don't, not that everyone knows anybody knows everything, but if you don't know enough about it, it's actually worse than knowing nothing about it.
Yeah,
100%. And when I had the supplement shop, I tried to educate so many people who were coming in to buy stuff. Like I was Jack 3D, the boyo of pre-workouts back in the day. Powerful as shit. 1-3D, I mean, and I was getting housewives coming in, like Karen and a 35-year-old, and she's like, my friend says that I should be taking Jack 3D because her personal trainer says that it's great for losing weight. And I'm like, whoa, no shit. That sounds like it's banned. And that's exactly what happened, didn't it? That wife took it and died because she used it in a marathon in a Camelback. There's a question of Phil, but I think it'll be best asked and answered after the next bit, because we're going to talk about the blood analysis, which you're going to be doing. Do you want to give a rundown on that? What it is, how it's beneficial to a regular ordinary person? Like, I'm really interested in it. I've texted Ellie all the time, like, you got to up and running, let us go. But yeah, go for it.
So with blood analysis, it was kind of the last 6 months of my master's degree. I kind of wanted to specialize in analyzing blood and understanding blood a little bit more, not necessarily just purely for performance, but also from a health perspective for just your average Joe. So I spent those kind of final 6 months being my kind of specialist area, the area that I really, really wanted to work with. And then I've got together with a blood analysis laboratory where I will take your blood. So you come to my clinic, I'll take your blood, I send it off to the lab. It's sent through a blood analysis machine, and then they send me that back, and I'll talk you through those results and kind of give you a kind of overview on how we could improve some of those biomarkers to improve your health, to improve your just general well-being, whether your libido is really low, whether you're trying to have a baby and you want to check what your fertility levels are like. Just a kind of broad range. So I've broke it down into the 5 key things that I want to look at. Just a general full blood count, which is going to look at liver function, it's going to look at your HDL cholesterol, your LDL cholesterol, and the vitamins inside of your body. So that's just a general kind of overview of what your blood's looking like. Your blood's going to tell a story about what the functionality of your body is, what your nutrition is like, what your sleep patterns are like, whether you're deficient in certain areas. And off the back of your results, what can we do to try and make you sleep better? What can we do to try and bring your cholesterol levels down? What can we do to try and take your testosterone levels up? Blah, 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 blah. We're then going to look at thyroid function. That's one of the second tests we're looking at. And thyroid function obviously gets a lot of bad press, your thyroid, whether it's underactive, overactive. So we're going to look at the thyroid stimulating hormone in that, and then also T3 and T4. With T3, we're looking at that. T3 is what's going to affect your metabolism, whether your metabolism is going to be incredibly fast or whether your metabolism is going to be really slow. Again, there are certain things which we can do to try and reduce your metabolism speed down, or to also try and increase your metabolism speed as well. And we're also looking at T4, which is kind of bone health and brain health, massive benefits for just general health and well-being. Liver function tests. Liver function tests are something I've had issues with my liver in the past, purely off my bad training and my bad decisions when I was kickboxing and I was trying to compete at a high level. And off the back of that, I really want to try and push the benefits of just looking after your liver, looking at things such as globulin levels inside your liver and how we fight infections, obviously the amount of alcohol that we're taking, albumin, which is how the nutrition in your body is working. Is your liver working correctly? Are you getting enough nutrition into your liver, or the correct types of nutrition into your liver, and how that affects kind of everyday function? But the 2 tests that people seem to really be asking me about are female hormones and male hormones. Very, very similar tests in regards to performance. performance is really based around testosterone, and testosterone is secreted in the testes in males and in the ovaries in females, and a reduced amount of testosterone is going to have a really negative effect on your energy levels, hence a massive effect on your performance in sport or performance in just everyday life. Your sex hormones, what your libido levels are like. So if your libido level is reduced down, why is that? And can we naturally bring that back up? What I really want to push is naturally. I am not going to be one of these medical clinics that is going to be pushing testosterone replacement treatments and stuff like that. This is purely from a natural level. Estrogen levels. So we've got testosterone, the male hormone, and then we have estrogen, the female hormone. Estrogen is massively important. It gets some really bad press. Incredibly important in the kind of the menstrual cycle and regulating the menstrual cycle in females, but it has to be at the correct level. And if that estrogen level is too high, it will have a negative effect on your testosterone level, the male hormone, and it is going to make you more likely to gain fat. Your energy levels won't be as high. Your libido is not going to be as high. So we have to have this correct balance between both people. And then in males in particular, depending on how high your estrogen levels go, it's going to make you female. It's going to give you moves. And I know we laugh about moves, but it is. It's the sex producing hormone, or the female hormone that's going to produce these female qualities in a male body. So again, with males, we need a much higher level of testosterone and a more reduced level of estrogen. If your testosterone levels are low, how are we going to fight that from a natural level? And the two main precursors for testosterone boosting in males and females, and something we should all be looking at, and something that these biomarkers will read in blood analysis, is zinc intake and vitamin D intake, vitamin B6 intake as well. So they are precursors to testosterone production. And what foods hold good amounts of zinc, good amounts of vitamin D, and good amounts of vitamin B6. So looking at implementing beans into your diet, implementing oily fish into your diet, tuna, milk, the yolk of an egg. Do not be scared of the yolk of an egg. An amazing qualities inside of the yolk of an egg. And I'm not telling you to eat 20 yolks a day, but a yolk to help naturally boost those testosterone levels. But then we also need to look at phytoestrogens, which are the types of food which are going to increase estrogen level inside of the human body, in males in particular, such as wheat. And I am not going to stand here and say that nobody should eat wheat. However, if your testosterone levels are high, and I look at your blood and your testosterone levels are low, and your estrogen levels are high, if we play around with your diet and foods which are containing phytoestrogens, which are bringing your testosterone level down and they're taking your estrogen levels up, we can naturally increase your libido, increase your performance levels, make you sleep better, and just have proper function of the human body. That's pretty much an overview. You want to be as energetic as you possibly can be. Maybe not as energetic as I am every day. It drives my partner insane, but we should have good energy levels. You shouldn't have to have 10 cups of coffee a day. And I say this to guys all the time, and guys alluded to pre-workouts before.
How much pre-work you were like? I was going to have a sit down with you.
I will nearly have a sit down with them.
I was going to have a sit down with you.
Intervention time.
Yeah. So for me, pre-workouts have their place, but they're also a little bit of a sign. If you need a kick before you go and exercise, is that not your body telling you something?
Yeah. I discussed this like in the supplement when we talked about supplements and episodes, and I said massively like in the media at the minute is like in social media and stuff. What's pushed massively is pre-workout because it's something easy for companies to sell. It's something you can feel instantly working. The kids are all banging dry scoop
Monster.
That thing at school, washing the doom with Monster and stuff. So everybody's pre-workout is in your face in the minute. People say, "Should I take a pre-workout?" If you don't need to, no. And I told the story about I used to train all the time. Never used a pre-workout, and then when I was working the British Airways was like, "Do you want to try this pre-workout? It's awesome." Back in the day, it was all no explode, and I was like, "Yeah, whatever." Yeah, being the addictive personality I've got, you know me. 3 scoops in the morning. I've had 3 scoops. I've had 3 scoops before this started. Like, but this is what's, I want the blood analysis done, not for my performance. I want it for my general health. Like, Claire was like, "What is wrong with you?" Like, I was holding onto the bench the other day. It was like 2 o'clock in the afternoon, and I was head on the bench, absolutely knackered. And like, I'm always tired. Like, and I literally plan my day on my caffeine intake. I get up in the morning. I don't like coffee, so I take pre-workout, whether I'm training or not. Comes to 2 o'clock, I spike myself back up. Comes to 6 o'clock, I spike myself back up. And this is me every day. Not using large amounts anymore, but it might be just might be mental. But
then if you look at it from a chemical side there, so you're saying that at different points of the day you're taking different amounts of caffeine. Caffeine has a half-life of 6 hours. So if you take 100 micromilligrams of caffeine, it's 8 a.m. in the morning, you're going to get a massive spike of that. But at 2 p.m. in the afternoon, you're still going to have 50 micromilligrams in. So you smash another 100 micromilligrams in there. So you're at 150. 6 hours after that, at 8 p.m., you're still going to be at 75. 30 micromilligrams of caffeine affects your sleep. Do you know what gives you the most energy, more than anything? A good night's sleep.
A good night's sleep. I don't know this, and I tell people.
And your awful process started off the back of having a bad night's sleep. And it's 10 years after that now.
It's a cruel trick, isn't it? You know. One thing I was thinking of when you were talking about the blood analysis, obviously it has dozens and dozens of benefits. But I was thinking about, so it's a bit like a map, isn't it? Like, you can see potentially where things have gone wrong, either in your diet or in your sleep, or I imagine probably your water intake is a part of that as well.
Yeah.
Is that something that you could hypothetically, obviously not necessarily for everybody, but hypothetically look at and go, okay, well, I'm not saying, guys, stop taking 3 pre-workouts, because that's obviously a massive change for somebody who is in that position. Whereas, could you suggest, well, of these 12 indicators that are negative, if you kind of make a small change in 3 or 4 or 5 of them, you will see a difference? Is that something that you see happening, or is it a case of you're going to need to cut out this altogether? Which would you say is more
definitely
realistic?
Definitely. So when you look at biomarkers in blood, so let's try and think of a good example of this. So like so let's use male testosterone for an example. So the sex-producing hormone and testosterone are very closely linked. Your libido may be incredibly low, but your libido might be incredibly low because your testosterone level is being smashed by the amount of caffeine you're consuming, the amount of training you're doing, and the poor quality of sleep you're having. So that is then, because your testosterone levels are so reduced, it's having a really negative effect on your sex hormone levels. So your libido is then really low. If your libido is really low, you're not in a very good mood. Your partner's not in a very good mood. Again, that's going to pull you down even further. So it's just having this catastrophic effect.
It's a compounding effect,
all off the back of you trying to push one of your ego. We talked about deadlift before. Your ego that I want 250 kilograms deadlift. I'm just going to push and push and push and push and push and push. And that your testosterone level is coming down. You're getting nowhere near 250 kilograms, but it's also having a negative effect on things such as your sex hormones.
It's good. It's dripping into you, like you say, your partner, your thing. And that's me. Like, I'm knackered all the time. I'm irritable. And then that's why I want my blood analysis. And then you go, right, this is what we're going to do. And then, constantly get my blood analysis until I'm into a better place. You know what I mean? Like, 4 weeks time, this is starting to improve. Keep doing this. Let's try doing this. And
where are your zinc levels? Where are your vitamin B6 levels?
And I think,
because we talked about
ordinary person, it's massive. I think like in the busy lifestyle everybody's living, which everybody should be getting this sort of treatment. People should be looking into their blood and stuff. How many people are too tired to do this? And he's always miserable as shit, and he's tired. He's gaining weight faster. Like, there's so much you could change in your life by looking into your blood analysis, and then you wouldn't feel like you have to kill yourself in the gym, be so restricted on diet. It could give a massive value to people's life back, I think.
I think the way I'm thinking of it, and again, I don't know if this is necessarily accurate, but this is the way I'm thinking of it, is I mentioned it being like a map, looking at your blood analysis, and it shows a map of what potentially is wrong for want of a better word, with your current lifestyle. Well, if you look at that map again in 6 weeks' time and 12 weeks' time and 18 weeks' time, surely that's going to lead you down the path that you need to be going down, because if certain things are improving, that's going to make you think this is working, which is great, but it's also going to show you where you could do make other small changes. And it becomes a compounding effect. Rather than things getting progressively worse, you can see them getting progressively better, or the way to make them progressively better. And then, as you said, if you're sacrificing X, Y, and Z in the pursuit of better gym performance, well, if you reverse that back and you fix X, Y, and Z, that will almost certainly lead to better gym performance anyway. So you're going down the wrong road to get to the right destination. That's the benefit I see of it. Yeah.
And a lot of people have been pushing biohacking for years and just taking control of your life a little bit.
Yeah. If you think you go to the dentist every 6 months so that they can spot a trend that we need to fix. Well, if you do that for your teeth, why not do that for your whole body? It's probably the kind of the way to think of it, is like, think of it like a service for yourself.
This is going to lead into the question that we've got, but it's like, why do you think that the type of treatments offered by Ross isn't utilised by the NHS more?
Price.
That's the question. So the
price.
Treatments you do, why
price? Price and time.
Price. Yeah.
So I have 40 minutes with my patients, and if you work in the NHS, you get 10 minutes.
Yeah, no way near that.
Yeah, and I think in the price, and I'm talking purely musculoskeletal therapy here. And again, I'm not trying to have a go at the NHS, because I absolutely love the NHS and I work with the NHS.
We're talking broad scale.
There's a lot of, in the NHS with musculoskeletal therapy, and a majority of private practitioners will agree with me here, it's treating the symptom, not the cause.
That's something I meant to say about half an hour.
So I heard a great analogy last week. Imagine you had a knocking in your car engine, and there was this constant banging noise in your car engine.
Turn the radio up, problem solved.
And you go to a mechanic and he just tells you to turn the radio up.
Yeah.
That's what majority of pharmaceuticals are in MSK. You've got a bad back, right? Take amitriptyline. Right? No, why don't you just fix what the problem in your back? You don't need to take amitriptyline. You don't need to become reliant on a pharmaceutical product. Fix the problem. Work the problem, as the Navy SEALs say.
Going back to the analysis and that, that's what I went blank on before I asked the question as well. I got my bloods taken by the NHS, by the doctor. I went to the doctor. I said, look, if something's not right, I've never got energy. I'm gaining more weight than I should. Like, I know my calories now. I know I drink all the time and shit, but I'm gaining more calories than I should. I'm gaining more weight than I should do, and I'm irritable as shit. My mood's on the floor. Like, I think it might be my testosterone. I'm not the doctor, but can I get my bloods done? Yes, I get your bloods done. Bloods came back a week later. Rang the what the hell is it called? The Marine Medical. And says, I've got my bloods done. I'm just waiting to see what's been done. Oh yeah, it's been done. Right, can I speak to the doctor? No, she says it's fine. It's fine. Yeah, like.
But right. again, going back to defend the doctors.
Yeah, I'm not splitting the doctor, but everything was fine. But what I'm saying is, I asked for the results. They sent us the results, but the scales are massive. Like, my testosterone was apparently done between, the scale is between 18 and 65.
Yeah.
Like, of course, I'm going to look like I'm all right at that. You know what I mean? Like,
so this is a little bit like BMI. So it actually annoys me when fitness professionals say, why do the NHS use BMI? Because there's 68 million people in the UK. So we've got to have you with your doctor for 10 minutes. And majority of the time, a 6-foot male will weigh within this range. And hopefully the doctor has enough savvy about them to think, well, actually, that guy's pretty stacked. So he's probably just outside of those markers. And that's going to be the same for blood analysis in the NHS. However, you picked up on this before, trends. So let's use how WADA, going back to performance enhancing doping now, it's not necessarily done with one test now. So the test retesting over a basis of time, if you have athlete A and he had 25% testosterone in comparison to all other athletes. But in 8 tests time, all of a sudden he's got 75% more than what he had in test 2. There's no correlation. It's not linear. His testosterone's just all of a sudden gone through the roof. And that with blood analysis in the private sector, you come and get your blood tests done. And I say, look, this is slightly high. This is slightly low. We're going to try this. And then, like you've just said, you come back in 5 months' time and we test it again. Look, there's a trend here. You're really depleted in this area and we've changed this. Have you adhered to it? Yes. Can you guarantee you've adhered to all of the things that I said? Yes, I have. Right. So we're going to try this. And again, you come back. However, in the NHS, guys, you went once and the only marker they have is the past 100 people that they measured using centiles.
Yeah. So one thing that's in my head there when we're talking about testing and stuff, obviously on a weight scale, when we're talking about people's weight and scales, using the scales, we're trying to eliminate variables. So same day, like first thing in the morning, that sort of get. If you were managing somebody on the blood analysis, what variables would you take? Like obviously, is that
so? That's a good one.
Would it be matter? Like, would you see the day before? Would you do XXXX to make sure that it's the same next time? Like, obviously, don't have a drink because that's going to
don't have a drink.
Liver function.
With male hormones, the best time to take it when your cortisol levels are highest is around 9 a.m. in the morning. Right. About an hour to 2 hours after waking. And then for female hormones to be accurate, the female has to be in the middle of her menstrual cycle.
Right. So if you had a client who was a female, you would say like they book it into that schedule and then keep it the next time they come in, trying to keep them variables the same.
Absolutely, yeah. So I wouldn't test somebody's blood markers at 5 p.m. at night because there's too much happened throughout the day.
Yeah.
To affect
and it would depend on what had happened in that day. So, for example, if you've had a bad day at work, your cortisol levels in particular might be different, and that has a major effect.
Yeah, and even we know the caffeine affects cortisol levels.
Yeah,
cortisol levels, and you might have had 6 meetings at work, and you just because we do the nature of a meeting, you walk in, there's a pot of coffee in the middle, so you'll have 6 cups of coffee when you didn't normally do that. However, if you wake up in the morning, we've been kind of starved, or what's the term they use in fitness now?
Fasting.
When you do it fasted, that's the one. Fasted.
We love fasting, don't we, guys?
I'm in the fasted program. If you're paying for it, then you can be fasted.
So it's interesting, really, when you think of it, because we talked about it briefly last week more than briefly about eliminating those variables. I don't think that is not even a question that was on my mind. When you think of blood, the ordinary person, you think of blood, it's just blood. It's just the same all day, every day. It's just your blood. It just takes oxygen on your body. And what you're saying is, it really, really isn't. Like there's much more to it than that. And not just much more to it, but much more that you can actually affect to have a positive effect in your life. Yeah. Which is kind of like, that's kind of, I don't know what the word is, kind of empowering to feel like I can make myself healthier, significantly healthier in a lot of ways, and affect things like how many people struggle with their sleep? Pretty much everybody, definitely me. And you can have an effect on that. And yeah, it might cost you some money and it might be an inconvenience to stop taking pre-workout or stop having as much coffee or stop doing these things, but that's got to be worth the reward. Yeah. The reward's got to be worth it, surely.
I think for blood analysis, for me to kind of
move my son to my mom's house, that's what I'm going to have to do.
to kind of tie up the blood analysis thing in the best way for me would be to say that it's going to give you an idea where you've been, an idea where you are, and it's going to give you control of where you're going.
That for me is absolutely priceless, and that cannot wait to get started, mate. Like, I know there's something not right, and I'm so excited to get on that. There's a few things coming in. This one, I think, I don't want to not address stuff, so we'll just address it. So it goes back to what we talked about price and time and stuff. So we can conclude it's easier and cost effective to prescribe some pharmaceuticals instead of running some diagnostic tests. I think that's something, I think it's too harsh to say yes or no to that. I think the NHS does a brilliant job within the guidelines that they're allowed to work within. I think that's the best way we can acknowledge that. I've had some horrendous stories with the NHS with injuries, but I've also had some really good success stories, and we'll always go straight back to the negative time. You would restaurant.
And let's
to say that a restaurant's shit, but you wouldn't go, oh, it's the best burger in the world, and go on and sing it.
Yeah.
Everybody will always
Let's take my last week as an example in my clinic. I think because that is worth addressing, and the NHS are phenomenal, like absolutely phenomenal. But in my last week in my clinic, I probably saw between 40 and 50 patients. And in that time I saw, and this isn't patient confidentiality, strains in muscles, maybe a couple of meniscal problems in the knee, a couple of cartilage problems, a couple of ligament problems. Not one of those things could have caused severe problems in that person, nor could they have caused death. So the NHS's main priority
they've got a remit,
is illness, disease, and pediatrics for me.
Yeah.
That's where I think the NHS excel above anything in my eyes.
Enough,
Pediatric care in the UK is second to none. I would not want my two little girls to go anywhere. Phenomenal. Absolutely phenomenal.
Suspected sepsis at 2-year-old into the doctor. I was like, I could not, like, them people are absolute saints. But again, you've got to look at what the NHS in injury aspect, what their job is. Their job isn't to get me back competing. Their job's to get me on my feet. That is what their job is. And as much as it was frustrating that I was re-injured, they were doing the job that they were assigned to do. They got us.
This happens quite a lot, and you know, I've said before,
and not being set.
Yeah, I've worked in a lot of different positions in the past, and the thing that frustrates, especially if you're working in sales, for example, is when your ideal outcome and the customer's ideal outcome are different. And that obviously is where a lot of sales break down. And it's the same thing in this example. It's like you're looking to get back in the ring, so to speak, and they're looking to basically get you out and able to get on with your life. And if those two things aren't aligned, and it's nobody's fault, well, then of course
and they've actually achieved their goal.
But the person, me, will always feel the victim. I'll skip one and come back to it because it's bigger. Because the question of Gail says, when you're starting the blood analysis, Ross?
So the blood analysis, I have the ability to take blood now, but over the next week I am going to be releasing some videos which breaks down each individual test and what the benefits of each test are. And then I can't remember the date exactly, but it's essentially a week from Monday the analysis website will be live.
And I'm assuming prices and whatnot are all going to be on the website as well. And is
$1
it
million.
Is it a case of like each individual test has its own markers, therefore its own potential benefits, and has its own price, or is it a case of
for example, thyroid, it will be the cheapest because there's only 3 biomarkers I'm looking at there.
Okay,
whereas something like male hormones or plus, we're looking at 20 to 30 to 40 different biomarkers. So that analysis would be slightly more expensive. What I do have the ability to do as well is bespoke. So if we looked at your baseline and we saw that certain kind of, some of your biomarkers were slightly down, your zinc levels were low, your HDL was too high. And we worked on that over a number of months, and I just wasn't seeing the benefit that I wanted to see. We could order other little bits here and there,
right? Like
so we can almost tag them on almost like a cocktail and pull them in and say, look, I want to test these because we've got a good analysis now of where you were and where you are now, but I want to just bring in maybe a little bit of testosterone just to see where your testosterone levels are, so we can kind of bespoke it to you as well.
That's amazing.
Yeah, that sounds good.
I know we're putting on time, Ross, so thanks, but this is quite a big one. Would getting your bloods done help towards finding out which could improve your mental health by improving your physical health? Example, what looks like depression could really be lack of something in your diet regards to moods and etc.
So the mental health one, didn't you? Right.
Yeah, it's a big subject, isn't it?
Yeah, such a big subject.
I know. It's going to have to be
such a big subject.
But I think even down to the level of saying vitamin D, like a lot of us suffer from vitamin D deficiencies, and it's a massive mood enhancer. I think once you get to a good level.
I think with mental health, obviously, mental health is something that I don't think I'm not qualified enough nor experienced enough to discuss it. However, off my own personal experience, and I'm talking about me purely here because I don't want to talk about my patients' mental health or any of the athletes that I've worked with. If I exercise well and my nutrition's good and my sleep's good, my mental health is better.
Yeah. So I think the blood
and I think
good.
on the groundwork, the ground level of just mental health of things that we can control, yes.
Yeah. Not the chemical imbalances and stuff. And, but like I've said about 4 times in here, I know something's not right. So that's going to be negative. That's going to bring us down. Like I know something's not right with us. But if my blood's got me back on track and I wasn't taking pre-workout all the time and I wasn't doing this and that, my mental health would be better because I'm not worried. I'm not like there's something wrong. No, I'm on a better track. I'm starting to feel better. I've got more energy, whatever it may be. And that could be down to the blood and also putting everything in line.
So I think if you think of your mental health, and it doesn't work like this, I'm sure, but if you think of it just, for an illustrative point of view, as a scale of 0 to 100, what we're probably saying is this isn't going to take you from 2 to 98, but it might take you from a 50 to a 60, and that can be enough of a difference. If you are controlling the things you can control,
it could be the reverse domino
it's going to
effect.
be
That's
better.
what I'm talking about. If things are going better, you know yourself, if things are going better, you're in a good mood, you're in a good place, but as soon as it spirals, it goes to it could make you feel better. I think
I like that. That makes sense.
I think that, and you can put that spin, Gaz, on what you've just said. If things are going better, you're going to be better, or you're more like that. Can be said with so many things in life.
Like, when you're late for work, you get stuck behind every slow driver.
Yeah, and you probably don't.
You don't.
It's just
you're like and then everything goes wrong. But if everything's going right, you're not stuck behind them drivers.
I think momentum is such a massive deal, isn't it? Like in
momentum's massive. Momentum's massive, and I think even down to the society that we live in now. We live in this society where we want everything straight away. That's why Amazon
exists.
Exists. Well, am I going to drive to B&Q now to get some screws, or am I going to order them? Somebody will deliver them to my house tomorrow. I'll do that because I don't want to say even Netflix. So
I was going to say Netflix.
You don't have to wait a week to watch these documentaries. You've got them there ready to binge. And then even if we scale that down into the gym, you try really, really hard on your diet and you just maintain weight on a Saturday, and the momentum's gone. And not only is the momentum gone, that spirals out of control that you end up eating a pizza, a bar of chocolate, 4 donuts, 2 Kit Kats in a small village of people.
Like that's breakfast sort of.
So, well, I've lost any weight, so stop it.
Yeah, what's the point?
We've stepped on that loads of times. Either you give up, you binge, or you starve.
Yeah.
That goes with the weights and the gym and everything. It just but when it's going right, it's going right. And
how good would it be if salad tasted like chocolate and salad smelled like that smell when you walk past the fish and chip shop? Like that would solve everything.
Until you mash it and it becomes 4 sins.
No, don't.
Well, listen, I mean, Ross, obviously, I know you've known Gaz for a long time. We've obviously just met today. I think this has been absolutely mind-blowing in terms of from an interest point of view. I think it's one of those subjects where people probably don't give it anywhere near enough thought. I'm speaking for myself, definitely. And I think it's been added a lot of value to myself, and I'm sure that goes for everybody who's listening as well. So just want to say thank you so much for coming on and taking the time.
No problem. And if anyone wants to ask me a question, just my website's just rossgladwin.co.uk, and just contact me through the website and I'll do my best to answer it. And if I don't know, I'll ask. I like learning as well. Sometimes I find out things which I don't understand. It makes me go and learn and me grow. And that's a good thing. It's not a bad thing.
Absolutely. Yep. All right, cool. That was really good. I've really enjoyed the last 20 minutes.
Thank you very much.
Thanks, guys. Cheers.
All right, cool. See you next time.
Take care. Bye-bye.
Bye. I think that's pretty cool. Thank you, everybody who asked questions. It's been one of our most interactive ones, so really appreciate that. I got a lot of value off that. I speak with Ross quite often, and I pulled a lot of value off that. I learned a lot off that.
Absolutely.
Loads of gold nuggets in there. Really, really good. Like you say, it's rossgladwin.co.uk. shit, russgladwin.com. He is phenomenal. I've sent clients there. I've sent my martial arts students there. Everybody who comes back has come back with such good reviews. Every ailment I've got, I go there. My knees, my back, my neck, my shoulders. He's fixed everything for me.
Awesome.
So thanks very much. This should be available on YouTube within the next 24 hours. Should be up.
Yeah, definitely. Yeah.
It should be available. I think there's a problem getting it on iTunes. I'm going to have to look into that. But it should be available on Spotify within the next hour as well. The audio only.
Awesome.
That was awesome.
Thanks everyone for your questions and for tuning in, and to everybody listening after the fact. Ross is probably now booked up for the foreseeable future. Thanks to guys.
I'll not be getting my blood analysis done now, will I? Be like, oh, sorry, mate, too busy.
All right, cool. Well, probably same time next week, I guess, or maybe a little bit earlier if I'm not working that day. I don't think I'm working on Sunday, so maybe we could do 5 o'clock. But we'll figure that out and we'll let you guys know. We'll keep you posted. All right, cool.
Finish off with a double clap, 2 claps and a Ric Flair.
Woo! Catch you later, man.
Cheers. Bye.